Okay, good morning Queensland. Well, we have 7 new cases. We have 6 that are in hotel quarantine and they are overseas acquired, 3 from Papua New Guinea, 1 from Ethiopia. There is 1 historic case. We have 69 active cases. We have had 7,584 tests in the past 24 hours. And the Health Minister will tell us a bit more detail, but there have been over 53,000 vaccines across Queensland, which is great news. Now, today we have 1 new case in the community. Now, this is no need for alarm, and Dr. Young will go with you in go through in more details with everyone about the venues that we are looking at. But this is a good reminder and timely reminder to everyone across Brisbane and the southeast and across Queensland that we need to keep up our social distancing. We need to keep making sure we're doing our really good hand hygiene. And of course, we need to make sure that we're using that check-in app and leaving our details when we go to venues. Now, in relation to this 1 new case in the community, he is a 26-year-old man from Stafford. He was tested yesterday, but he has been infectious in the community since last Friday. So we'll be issuing health alerts throughout the day. And I really urge the media to please put out these venues. Now, it's really important that if you are sick or feeling unwell, to come and get tested. This is a really important message, and so far we're having those over 7,000 tests. People are doing the right thing, but we absolutely want people, especially over the next 2 to 3 days, to come forward and get tested if you are feeling unwell and you have symptoms. Now, in relation to some of the venues for the health alerts, and Dr. Young will go through them in more detail, but Carindale Shopping Centre, Bunnings at Stafford, fresh food market stalls at Newstead, there's a venue at Redcliffe, and there's a couple of venues at Stafford, but I'll get Dr. Young to go through those in more detail. So what actions are we taking? We are taking some immediate action. So from 12 noon today, our aged care, our hospitals, our prisons, people caring for people with a disability will be closed to visitors, but this will be confined to the Brisbane City Council areas and to Moreton. So just the Brisbane City Council areas and Moreton. So these are sensible precautions to look after our most vulnerable. What we are going to ask our people, of course, in the Brisbane City Council's areas and Moreton, is that if you are in crowded areas, to wear a mask. So, for example, if you're going to a football match on the weekend, wear your mask going into the venue. If you're on a crowded train, put a mask on. So these are the sensible precautions, and we'll be updating you over the weekend if there are any more cases. Now, can I just say this to everyone as well? Look, you know, it's great to see people out and about, and the last week I've been to a couple of functions where there have been over 300 people. Can I just make some observations? People are not social distancing. We really need people to social distance. And the other thing that's coming back is everyone is doing handshakes again. Please, we are still in the midst of a pandemic. Now is not the time to break our social distancing, our good hand hygiene, and the handshake. So I'm sorry, everyone, but we need to abide by these things if we're going to get through this. So, look, I want to thank Dr. Young for bringing this to our immediate attention this morning. We wanted to let the public know as soon as possible. It is absolutely imperative over the next few days, if you are sick and unwell, stay at home and go and get tested. Absolutely critical that we do this over the next 2 to 3 days. I'll hand over to Dr. Young.
Thank you very much. Yes, so we have a new case that has been acquired in the community. We don't know how. We'll be getting genome sequencing results late today or early tomorrow that will assist us in working that through. But now the important thing is to respond. So everyone knows exactly what they need to do and has done that brilliantly over the last year, so we just need to put that back in place. We need to make sure that we are socially distancing, and where we can't, to wear a mask. And if we're in that vulnerable cohort, maybe stay at home for the next 3 days till we understand exactly what is happening here. So at this point, I'm just asking that everyone adhere to the requirements that are still in place. That is, in indoor areas, 1 person per 2 square metres. That's really important. Outdoor, we know, is very low risk, so let's go out and really enjoy the outdoors this weekend. I mean, you couldn't imagine a better weekend. It's just perfect. So everyone, please go outdoors, enjoy outdoors. We know that's very, very low risk. If you're going indoors, make sure you adhere to the 1 per 2 square metres and maintain some social distance from people that aren't in your normal household when you're going out to restaurants and venues and things like that. That hand hygiene's important. And most importantly of all, everyone, please stay home if you're sick, as this gentleman did who's tested positive. Once he became unwell, he stayed home. He's been fantastic. Come forward and get tested so we know what's going on, so we can contact trace as he did. So please, any signs of illness at all, just stay home and get yourself tested. We don't know where this virus is next going to pop up, but as I've always said, if we can find the first case in the cluster, not the 40th, we'll be able to get on top of it much, much, much more quickly. So this gentleman developed symptoms on Monday. He became, reasonably unwell. He then stayed home, so he had been out and about in his pre-symptomatic period, as you would expect for a young man, so I'm going to go through all those venues. He came forward yesterday and got tested at the Nunda Respiratory Clinic, and we got those results late last night. We've now absolutely confirmed them, so we've tested him twice on different platforms, and both times he's tested positive, so we know it is a confirmed positive case. We are doing other tests on him as we speak, so genome sequencing, for example, and other tests, so we'll get those results through today and into tomorrow, which will assist us. But in the meantime, we know he's absolutely a positive case. So the venues he's been through, I'm going to go through in detail. We will get more information. This is very, very early information, and I'm very grateful to this gentleman. So we moved him to Royal Brisbane and Women's Hospital last night so that we could work and get this information last night and early this morning. So back on the 20th of March at around 11 a.m, he was in the Carindale Shopping Centre and visited quite a few places through there, so that's a risk area. Then at 8 o'clock he went to Baskins and Robbins Ice Cream at Everton Park at 8 a.m. Then on the 21st, so that's last Sunday, he went to, at 9 o'clock, Fresh Food Market Stall at Gasworks at Newstead. And then at 12:20, he went to Mama's Italian Waterfront Restaurant at Redcliffe. So we'll, of course, be working with all of these places to get contact details for the hospitality places where there's a requirement to have that electronic contact detail information available. So I'm very grateful to those venues who will be working with us. Then on the 22nd, which is the day he started to get symptoms, he worked in Paddington. He works as a landscaper, so that's good because most of his work then has happened outside, so we'll work with him about that. Then he went through at Stafford at 12:30 that day to Guzman and Gomez as a drive-through, so there's probably minimal risk there. But then at 1 p.m. he went to Bunnings at Stafford. Then he stayed home all the next 2 days and went and got tested yesterday at the Nunda Respiratory Clinic at Sandgate Road in Nunda, so of course we'll have contact details for that, which we'll work through. And he also went to the Aldi at Stafford for around 10 minutes that day. So we'll get all of this information out with specific time frames, and anyone who's been to any of these venues during specific time frames, I want you to come forward and get tested whether or not you've got symptoms, and to remain in isolation till you get a negative result. Everyone else who lives anywhere in Brisbane or Moreton Bay, it's really important. Any symptoms at all, please come forward to one of our many, many fever clinics and get yourself tested. That is critical. And anyone who lives in Brisbane who becomes unwell in the next 14 days, if you're going out and about your normal business, you might be visiting in other parts of the state, it's important that you come forward wherever you are in Queensland and get yourself tested. That's really, really important. That it is testing that will help us get out of this particular incident, as we have with other incidents as we move forward. Then, of course, we are protecting our most vulnerable, although a lot of them have already had their first dose of the vaccine and even getting their second dose. Despite that, we will be putting a requirement on aged care, disability care, corrective services, our prisons and our hospitals in the Brisbane and the Moreton Bay area to limit visitors and to use masks, except for, of course, end-of-life visits. So we'll be protecting our most vulnerable, and that will be in place from midday today. Everyone else, I'm asking, go about your normal business, but be a bit more cautious. Stay home if you're sick. And if you're somewhere where you can't socially distance, for instance in supermarkets, on public transport, going to big games at stadiums and so forth, put a mask on. Once you're seated and in a seat that we know where you are, you've got a ticket and a seat, you don't need to wear a mask at that point. But of course, if you feel safer or happy to, then a mask is always a very good idea. Thank you.
Do you have any suspicions as to where he might have caught it?
It's too early. I need the genome sequence first before I can work that through. But he has not been overseas in his period that he would have acquired this.
Dr. Young, does he have flatmates that close to him?
Yes, and they're all in immediately, of course, in quarantine.
Do you know roughly how many close contacts have been contacted so far?
We're very early. I found out about this, 10 o'clock last night. So they've done an awful lot of work already, and all of that work, as you've pointed out, is progressing rapidly.
Are you expecting an increase in locations then over the next couple of hours? Because
I am. I think for him to have remembered this information is just brilliant, and he'll remember more, and we'll be working with him. He's been extremely helpful, very, very helpful, but I would imagine that we'll see other venues and we'll put those out there as soon as we find out about them.
surely it's quite concerning though that there's absolutely no link and he's been out in the community infections for a week.
Of course it's concerning. That's why we're here this morning before having all of this information, letting the community know. The most important thing is that everyone, we're not out of this pandemic. It's so important. If you get any symptoms at all, come forward and get tested like this man has done. That is really, really important. We did just have an outbreak within the last 2 weeks in South Brisbane. So there's a chance it's linked to that one. We won't know until we get the genome sequence result.
How many people could have been exposed to him? Hundreds, thousands?
Yeah, he's a young man who's been out and about in his normal life. So yes, I'm sure he's had contact with a lot of people. That's why it's really important for everyone, if you have any symptoms, to come forward and get tested. And I don't know where he's got it from, and that person he's got it from could also be out and about in our community spreading the infection.
You mentioned he was in hospital. How severe are his symptoms?
They're not severe. That is just to make it easier for us to talk to him, to get all this information, to remove him from his housemates and to just manage it. So I'm very grateful that he's come into hospital and we can work with him there.
You urged vulnerable groups to stay home for the next 3 days. Can you just recap who falls under that category?
People will know themselves if they're vulnerable. So if anyone feels that they're in a vulnerable category, it's not changed. It's people who are older, it's people with underlying health conditions, then they just might like to think about what they're doing this weekend. If they're going in a family group, then of course that's not a risk. If they're going outside, it's not a risk. But it mightn't be the time for them to go to a very crowded venue.
Can Queenslanders expect to see more restrictions over the next 24 hours?
I I definitely hope not, because I think Queenslanders know how to respond to these things and do it really, really well. And we've seen that for the last outbreaks we've had. Queenslanders know what to do, they do it well. So I would hope we don't need to have more restrictions, but it just depends what unfolds over the next 24, 48 hours. But we need to get used to living with this virus. We're getting more and more people vaccinated. We've got great stats there. So as we get more people vaccinated, the requirement to put restrictions in will diminish. We're just at the cusp at the moment between having to put in restrictions and having people vaccinated.
As you mentioned, some people have already had their first round of vaccinations. Should they feel some sense of ease that they've got a level of cover there?
Yes, of course they should. But we really need people to get the second dose and then to have a week after that to be fully protected. So they just have to be a little bit careful still, but one dose gives you significant protection, 2 gives you fantastic protection, and then after that it takes about another week to get that full protection.
You mentioned he got tested, then went to Aldi. Did he do the wrong thing and not isolate?
He only went there very, very briefly, and you can just imagine what he went there very briefly. He really and truly was fantastic. He stayed home those 2 days.
Usually, though, you would recommend against that, though, wouldn't you, after you've been tested?
Well, no, he went before he got tested.
Oh.
I'm sorry, I made that unclear. No, he went home after he got tested. Absolutely. He just popped in on the way through, which you can imagine. He spent 10 minutes there.
How many cases in Queensland at the moment have the PNG variant? At the moment? Do you know?
I think it's, of our active cases, it's around about 2/3 have got that PNG variant. Now, the PNG variant is a different variant, but it's not a variant of concern, if I can make that clear. It's just, it has developed and it's restricted to PNG in Australia because it's developed in our part of the world. But it's not one of those variants of concern that have been notified
Do we know does this
internationally.
man have the UK variant?
No, I said later today.
Oh,
Later,
yeah.
we need genome sequencing takes 24 hours to do, so we should get that hopefully later today or tomorrow morning.
I know you've sort of answered this, but what's the hypothesis for how he possibly got it? I think a lot of people would be incredibly confused. He just caught it in the community, or
Yes.
just
Yes, this is why we need those restrictions to remain in place. The 1 person per 2 metres, indoors, getting all those contact details, people maintaining their distance, washing their hands, staying home when they're sick, that's the most important one. We are not out of this pandemic until everyone's had the chance to be vaccinated. We really and truly are going to see this continue to happen.
given that, then is it really less concerned about this man and more concerned about the person who's still out there and potentially still infecting people?
Possibly, although that person might no longer be infectious. It's a bit hard to hypothesise on something you don't know anything about.
Have businesses been keeping up with the electronic registering of when people arrive?
That's what we'll find out today as we go to these businesses and ask for their details. But we saw in the last one with that doctor who was infected that the businesses involved there had very, very good contact details for their people.
The Premier touched on it. Do you think people are getting a bit complacent with shaking hands and not socially distancing? And do you think, should we ban handshakes, or how strong of a measure do you think we need to put back in?
This is so hard for people. It's so long since we've had any outbreaks that I can fully understand. People want to get back to their normal lives. We all want to do that. And human touch is so important to humans. What I'm just saying is, please, while we go through this and until everyone's had the chance to be vaccinated, we need to try and maintain those boundaries between people that you don't know. It's important to touch the people in your own household. We need touch. But if we could, when we're out and about, try not to touch other people. That's important. It just is that other level of protection.
Has this man gone into the ward 6A at the Royal Brisbane?
He's been admitted to the Royal Brisbane and Women's Hospital last night. Yes.
Into that?
I don't know. I think he's gone into Wattle Bray, their infectious diseases
And
ward.
was the decision making behind setting up that hotel quarantine, and is it safe? At the Royal Brisbane Hospital,
Right. The Royal Brisbane Hospital is brilliant at managing infectious people. They are our centre, they are our lead hospital for the most severely contagious people. So they're the hospital for Lassa fever for all of those. You know, if we had a case of Ebola, so they know exactly what they're doing. And they've got other parts of their hospital that we're using as well for COVID cases. They know exactly what they're doing. It's perfectly safe, very, very safe. They're not a hotel, they're a hospital.
Premier, you must be concerned about this. We're heading into Easter soon. Are you alarmed about this case and the infection?
Oh, I think everything Dr. Young has said, you know, I think Queenslanders will do the right thing, and we've seen before we've come out of this, so as long as people go out and get tested, I think we'll come through it okay. But the next, like we said, it's the next, you know, 3 days will be very critical to see if there's any further community spread. And if people have been to those venues, please come forward and get tested. That's absolutely critical.
If he does have the UK strain, does that change things for you and then possible?
No, the advice from Dr. Young is that we've been able to manage this very well with the PA doctor, so we're actually following everything we've done there as well. So, but like I said, if you're in those crowded areas, put your masks on, and let's just see how we go over the next 3 days.
I mean, you may be able to answer this. The Ward 6A, the Royal Brisbane, what was the decision making in setting up a hotel?
That's a matter for health. Yeah. Okay.
Can I just comment on that? We're not setting up hotel quarantine for positive patients. I don't know where that term's come from. We have been looking at alternative ways of managing patients who are COVID positive but otherwise are well, and not needing to be in ICU or you know, dedicated sort of health treatment, but still having them in the hospital system. So we're looking at whether we can bring more of those patients to a single site as opposed to spread over different hospitals. So we've been investigating different options of taking pressure off the health system but still keeping them in the hospital. So there's no hotel quarantine for positive patients. That's what other jurisdictions have done. We don't do that. Everyone who's positive gets moved into the hospital system, but it's just how we manage them in the hospital system so that we can make sure that we're looking after them, but where they're otherwise quite well, they're there just to assure that we don't get broader community transmission. We're looking at how to best manage them in the health system. Can I just also say, as the Premier said, we've had fantastic results with our vaccinations, and I want to thank all of our staff working in our vaccinations, from our administrative and our booking staff through to our nurses and our doctors. We've had 53,893 vaccinations in Queensland now. That's just the state, so it's not including what the Commonwealth are doing in aged care and now the GPs. We had set ourselves a target of getting to 20,000 a week by mid-April. Well, we're going to achieve that by the end of today, so we're really thrilled that the staff have been able to hit that 20,000 target by the end of today, and I just want to thank them for that. Can I also just clarify, when we talk about Moreton Bay, we're talking about Moreton Bay Regional Council. So not Moreton Bay in the border sense as we know it, on the north and south side. It's Brisbane City Council and Moreton Bay Regional Council when it comes to hospitals, aged care facilities, disability facilities, and of course correctional services. And we do remind people social hygiene, making sure they're social distancing. If they can't social distance, wear that mask, checking in. And we did see from the PA positive case that of all those venues that were contact traced, I think there was only 6 people who hadn't checked in, which is a fantastic result. So we remind everyone that you need to be checking in. We remind venues there is an obligation on you to make sure that every customer that is walking in the door and is seated, that they're checking in, but also as customers we have the responsibility to make sure that we're doing that as well. We will also be ensuring that we have adequate testing clinic capacity for the next few days. So across Brisbane City Council, Moreton Bay Regional Council, we will make sure that we can, if need be, expand our testing capacity quickly The fever clinics in those areas will be open over the weekend, so I remind people that they can go out and get tested if they're not feeling well over the weekend. We do remind people that when these incidents happen, there is often lines. Please be patient, please be respectful to the nursing staff and the staff managing the fever clinics, but we will be doing our best to get people through those testing clinics as quickly as possible. But if you have any symptoms, stay home, get tested and isolate yourself until you have those results.
Just back on those setting up the new facilities for potential quarantine, is that in response to the Papua New Guinea soaring numbers and
Look, it's in response to increased numbers overall. So we know, we've been saying this for some time, we are seeing increased numbers of people coming from overseas who are positive. We're getting positive cases every single week. We have definitely seen an increase as a consequence of Papua New Guinea. Yeah, that is concerning, and of course the Commonwealth and the Premier's been talking with the Commonwealth about that. But we do need to be mindful. We are getting to what is our highest numbers we've ever had in the hospital system since COVID started. So 69 positive cases today. So we just want to make sure we're keeping the community safe, we're managing our positive COVID patients, and at the same time we're working with the hospital system to ease some of those pressures that we're seeing with the growing number of positive cases.
we've still got international flights coming in, one even from Papua New Guinea today, so that needs to stop.
I'll leave that to Premier to talk about what the Commonwealth might be doing there, but we're concerned about the number of positive cases coming in.
I'll just address that and then I might get back onto the contact tracing. Look, in relation to that, we are seeing basically every day now we're seeing positive cases in hotel quarantine, and over the last couple of weeks the large majority of them are coming from Papua New Guinea. Even though the reduction has happened, I do think that this is a really serious issue, and I'll be having further conversations with the Commonwealth Government about that.
Are you frustrated they weren't supporting your proposal to have a facility out?
The departments have been speaking, federal and state departments have been speaking about that, but as I said very clearly, we need an answer from the Commonwealth. Are they interested, yes or no? It's a very simple question. Okay, thank you.
Thanks, everyone.
Thanks.